What's going on, everyone? Welcome back to the Adam Nessim Show. I have an awesome guest with us today. We have Dan Greenberg, who is a fourth-year dental student at Stony Brook. He's currently applying for residency, and he's also a business partner of mine and is the head of the pre-dental consultant. So excited to have him on. Dan, welcome to the show.
Yeah, Adam, thanks for having me.
Awesome. So, we've known each other for a while. We actually went to high school together. Then we've been working together at the pre-dental consultants. And I know you're graduating dental school soon. Can you tell the listeners, because we have a lot of pre-dental, pre-med listeners, a little bit just about your journey to figuring out you wanted to go to dental school, applying, and then like where you eventually ended up, and then what you're thinking where you want to take your career?
Yeah, so I started out kind of like most people, didn't really know what I wanted to do. I was interested in healthcare from the very beginning. I come from kind of a line of doctors, so I knew that was kind of in my blood. So when I got to college, I kind of wanted to see where I was at. I shadowed some dermatologists, plastic surgeons, some internal medicine, dentists, optometrists, basically everything you can possibly imagine. And it really was when I went to the Galapagos Islands on a mission trip. It was a dental mission trip specifically that I realized that I loved everything about it. I loved the immediate impact that I had on patients, and I was just assisting at that time. And it was basically the first sort of experience that I had in the dental profession at all. It was kind of like first sight, and I loved it. And that's kind of where I came from. So I came back to the United States after the 10-day trip, and I wanted to get more involved. I was very motivated to learn more about dentistry, so I started shadowing a lot more in the field. And then that's kind of where I came from. And then while I was at Binghamton, at the time, I was an accounting major, and I really liked the business aspect of dentistry as well, which is why I sort of formed my entire application geared towards that. So I realized early on that I could graduate in 3 years from my undergrad, do a 1-year MBA program, and then go to dental school. So that's how I planned out everything to get to where I am today.
Awesome. And so what was your reasoning behind applying into accounting? Was it because you knew you loved business already going in, or you thought it would be useful? And then the whole MBA, or like because that seems like a little bit more non-traditional than most pre-dental students.
Yeah, so I was brought up wanting to get a degree that could be useful. And at the time, I came into college undecided. And because I didn't know what I want to do, maybe I want to go into something healthcare related, which I knew was definitely possible. I wanted to get a business background because regardless of whatever you do in your life, you could always use a business degree. You can always learn about business and apply that to your life. So I strictly went into the business school, one, because I heard it was difficult to get in, so I kind of shot my shot and saw if I got in, and I ended up getting in. And two, to graduate college with a degree that I know would be useful at a time where I didn't know what I wanted to do. Obviously, after I got into the business school, after my first semester freshman year, I realized, maybe I should take a look into business. So I actually interned in Morgan Stanley in their wealth management department as another opportunity for me for a potential career. I liked it, but I couldn't see myself doing it. And then when I fell on dentistry, I kind of ran with it because I liked the whole idea how there was a whole side of business in dentistry where, I talked to doctors, and every doctor said, and every dentist, and this goes for, I'm sure, medicine as well, the worst part about being a doctor is the business, because it's a lot of time and effort and a lot of learning that you have to do. So I really wanted to learn that early on. And when I fell into this, when I started looking into dental schools, a lot of schools actually offer MBA programs that you can actually go into and do concurrently with your degree in dental school. So I actually have classmates that are doing that right now. And there's, at school until 8:00 at night. So I was very lucky in that I did this before I got to dental school to where I can just focus on dentistry and doing well.
Yeah, no, that makes a lot of sense. I feel like a lot of pre-dental students, and correct me if I'm wrong, go in thinking they have to be a very specific major, like you have to be a bio major to be pre-dent, and that's not necessarily the case. Can you speak on that a little bit, like what the options are for someone who's thinking about pre-dental, like feels like, oh, I have to be a bio major if that's the route I want to go, but as you've clearly shown and others have shown, that's not necessarily the case?
Yeah, so all my students know that I'm not very keen on being a bio major or a science major, for two reasons mainly. The first is that being a science major is difficult. You're taking upper level science classes, and that normally hurts your GPA. And there's a reason behind that. One is that they try to weed students out of these courses, and two is they're just notoriously more difficult than typical classes that you would take maybe in school. So a B in these hard science classes might be good for, the science majors, and you might be at the middle or even above average. But when you're actually applying to schools, you're seen as either average or below average with a 3.5 GPA, even though that might be really good for the school that you came from. So that's the first reason. The second reason why I typically tell students don't be a typical bio major is because you want to do something that you're truly interested in. And dentistry is not a profession where you're going to be studying animals and plants forever. You're not going to be looking at microbiology unless you're very interested in that and you want to do research or you want to do oral pathology. You're not going to be really doing a lot of that. So a lot of students will actually get thrown off their path by being a bio major because they don't think that they like that sort of material, when in fact that's not necessarily the case. So I always tell students, do what you want to major in, whether that's art, history, the sciences. If you love it and you want to do it, do that. I've had students who are math majors. I've had students who are engineering majors. Do what you truly like to do and do what you're good at, because at the end of the day, you can be any major and get into dental school.
Yeah, no, absolutely. That's pretty much the same advice I give to pre-med students.
Mm-hmm.
There are some advantages of, if you're a bio major, for example, it's much easier to get all your prereqs in. It's basically built into your major, but you need to make sure that you're keeping your science GPA up, which becomes a little bit harder because you're going to be taking these upper level classes. How would you say for students that are, let's say, an art major or a major, art might be a tough one, I don't even know, but let's say they're a major that it's like very easy to get A's in those classes, but then they're doing fine, but not as well in their sciences. How do most dental schools view the different GPAs? Do they break it out like that, where they're saying, oh, well, your science GPA is this, but your cumulative is this? We clearly know that those communication classes are lifting up your GPA. No shade to communications majors. That was just an example. No,
yeah, for sure. I actually had a science major that applied to school and got into dental school. So that's a pretty good example that you gave. But so what I tell students is if you're going to be a non-science major, you're taking the core science classes and you're not taking a lot of them. So it's more difficult to get a good science GPA because you have a less volume of classes to mask bad grades. So I always tell students that if you're an art major or a history major, get A's in those classes, but it's more important to get A's in the science classes that you're taking. And typically, if you are a non-science major, you can take one science class a semester until you apply to school. So for that one class, if you have 3 tests that week and that science class is one of those tests, you're studying your ass off for that science class because that's the more important class for you to get an A in, or a B+ in.
Right. So
always put the science classes above your other classes. And in terms of what you were saying before about do dental schools look down upon students who don't do as well in the science classes, I would say slightly. Because if you're going into a science profession, unfortunately, you're not going into, history or politics or econ, right? You want to make sure that you're doing well in the classes that are seen as prereqs, because those are the classes that you're going to be compared to amongst all the applicants. Because regardless of what major you are being compared based on the 5 or 6 prereq science classes that you need to take before dental school. So if you're getting C's in those classes and you were a non-science major, that won't look as good as someone who maybe got B's in all of their science classes.
Right. Yeah, that makes sense. It's similar to what I tell pre-meds is that the most important GPA, because they for pre-med, when you're applying to medical school, they break it into your cumulative, all the classes that aren't science, and then all the science classes. And so that science GPA is definitely going to be the most important. And you don't want that to be by far the lowest, because then they're going to be concerned you're not going to be able to handle the hard science courses that you're going to get in medical school.
Exactly. Is it the same for pre-meds? Like, do you typically tell them, major in whatever you want, but do well in the science classes?
Yeah, I say that you should major in something that you're actually interested in. A lot of students will try to play the game of like choosing a major very strategically where they're going to be able to get the best GPA. And I think that, I understand that idea, but I would do something you're actually passionate about. So if you're passionate about business, then I think that's a great opportunity to take business classes, because you might not have as much time to do that while in medical school unless you're doing like an MD, MBA. And so do that in your science prereqs and make sure you're obviously doing well in your prereqs. But if you really love biology and you want to be a bio major, I mean, still a majority of pre-medical students are bio majors. But regardless, you have to do well in your science classes and on the MCAT no matter what you do. And it also seems like in comparison to pre-dental students, there's more prereqs for the pre-med. So like they're not usually taking, it's usually 2 science classes I'd say they're taking per semester. Sometimes it could even be 3 if they throw an upper level science class in there. And so it does add up, which is why it's nice if like your other major requirements is like a health policy class. Like I had a lot of health policy classes or nutrition classes that weren't as difficult, rather than you have all those classes and then you're taking like a high level chemistry class or something like that.
Yeah, so actually to branch off that a little, I always tell students who are non-science majors, try to throw in like a health policy class or a healthcare management class, because that kind of gives you more depth into what you're learning and showing that you're actually interested in healthcare, even though you're not taking the typical science classes. And then lastly, it adds like a level of differentiation to the student as well, being a non-science major, because in every single one of my interviews, even for residency, the accounting and the MBA comes up and we talk about it all the entire time. And they love it. And, students who are history majors or econ majors, it's going to come up in conversation. Why did you go into that? What is it about that you think is useful, towards dentists? And that comes up with accounting all the time. Is why at the time did you think that this was a useful major to go into?
Yeah, no, absolutely. I think the key too is just being true to yourself. Like you obviously love business, and accounting was a really good segue into that. And we'll talk about, business in a little bit and the pre-dental consultants and everything you're doing there. But like a student that hates history but thinks being a history major is a good idea because it's going to make their life easier, that's not what I would recommend. But if you like it, or you find something even that we're not mentioning here that's unique, that's where I say, why not go for it? Because those classes, you'll never have another opportunity really to be in college and taking all these different classes that you actually want to do. And so that's a good time to try things out and learn from it and acquire skills and differentiate yourself in the application.
Yeah, 100% agree with that. Just do anything that you are passionate about. Don't do anything that you think is required, which is why most people go into being a biology major. They think it's required.
And just for the listeners that are thinking about, or maybe they are pre-dental but haven't done their research, what are generally the requirements, those science classes that you were mentioning that are required for dental school?
Bio 1 and Bio 2 with labs. So those are typically your intro bios. A lot of students will take the intro bio, kind of like the pre-calc to the calc of bios. And that is not one of the requirements. So make sure that you actually understand what the requirement is in your school. Same with Chem 1 and Chem 2 with the lab, Orgo 1, Orgo 2 with the lab. Biochem is a requirement at almost every dental school now. Calc is a requirement, or calc or stat, so some sort of math. You want a year of writing, and then physics is also a requirement.
1 and 2?
Physics 1 and 2. Yep.
Yeah. I mean, that is basically the same as pre-med.
Yeah. I mean, physics is kind of like that oddball because we basically don't use that in dentistry except for ortho. And I guess it is used a lot in dentistry, but not like the certain equations, kind of common knowledge in dentistry. Like we talk about torque, and different sort of like, we don't do any equations, but
You just need, it's good to know the
not
fundamentals. I always say, like, I understand why I took all those classes, like Orgo and things back in the day, because like Orgo relates to different things in biochem, but it's not like you're actually using SM1
You're not.
reactions in
Like
medical school
in
or when treating
medications, you
patients.
will be able to maybe pinpoint exactly what something is, but will you know the exact reaction of how you got that? Absolutely not.
Yeah, but if you're listening to this and you're a pre-med or pre-dental or pre-PA, you still got to do it. You could complain about that you're not going to maybe use everything later on, but it's important to do well in those classes and understand and have that foundation moving forward. Got it. So yeah, I mean, I know students, we've even had students transfer between our two programs, like going from pre-dental to pre-med or vice versa, because the requirements are so similar. What would you say your biggest advice then is for students that are studying for the DAT after taking most of these requirements?
Dedicate a certain amount of time to studying for it. So we have a 12-week program as a part of the pre-dental consultants advising, and a lot of students I find will say, I want to give myself a year to study for the DAT. And to that, I would say if you gave yourself a week to clean your house, you would take a week to clean your house. If you gave yourself an hour to clean your house, you would take an hour to clean your house.
Right.
So give yourself a certain amount of time to study with no distractions. And typically I like the 3-month period. I think that's the right amount of time to do it. If you give yourself too long of a period, you're going to find that you're not going to be as efficient and you're going to be procrastinating a lot more.
Right. You just keep pushing it off. Oh, I have time.
Exactly. And the biggest thing I've seen recently with my students and, students in general that message me on Instagram is they say, I'm going to study throughout the semester of school. And two things end up happening. One, they end up flunking their classes and then doing okay on the MCAT, or two, they end up doing really well in their classes, but put off, or put off the DAT, and then they end up not actually studying for it, and then they end up either having to extend their subscription to DAT bootcamp, or they have to extend their studying time or cancel their summer plans. So plan out a period of time that you will be able to dedicate time to studying for the DAT, not the MCAT, the DAT.
So when do you suggest is the best time for students to study for it and take the test?
The absolute best time to study for it is after you take organic chemistry. A lot of students will wait until they take biochem, which I do think helps for the DAT because you have a better understanding just of bio in general. But I typically say study for it after you take organic chemistry because that will be fresh in your mind. So it's basically like you're not even studying orgo because you just took an entire class on it. So it's going to be fresh in your mind.
Right. And it's much more heavily, the DAT is much more heavily orgo than the MCAT where it's like actual orgo questions. You don't get as much of that on the MCAT.
The DAT is organized to where there are 30 organic chemistry questions. And I would say anywhere from 20 to 22 of them are probably straight reaction questions, where I know it's different on the MCAT.
Yeah, no, you're not. You're definitely not going to see that many orgo questions. And if you do, it's usually like having to incorporate something from a passage, things like that. The way I like to, and correct me if I'm wrong, the way I like to explain to students when we're comparing MCAT to DAT is the DAT is more like a final exam for all of your pre-med or pre-dental prereqs. So it's like taking a final in orgo, bio, physics, chem all at once. And then you obviously have a reading section, a verbal section. Right. Whereas the MCAT is more, it used to be like that, but when they changed in 2015, it became more of a critical reasoning test where you really have to use passages and take what you're reading from the passages and then also your outside knowledge and answer questions. And they even then threw in a psych/sociology section. So now you have to learn like all those definitions. So those are kind of like the differences between the two.
Yeah. So for all the pre-dental students out there, the DAT doesn't actually have physics on it. But if you're a pre-optometry, that's basically the difference between the DAT and the OAT is that physics is on the optometry exam. But that's why I was saying before, we don't really utilize it that much. You have to know the fundamentals, but you're not going to have to do equations, and you're not going to have to know different reactions that occur. So it's very fundamental for physics, but we don't have that on the DAT.
Got it. But still have it as a prereq.
It's still a prereq. I mean, they should get rid of it, but they won't.
It'll probably stick around, more classes to take.
It will. I mean, physics is a funny thing because it, you know, at a lot of schools, the intro physics is through like the engineering department. And you know, they say D's get degrees in for engineers because they graduate as an engineer. Pre-dental students will take those classes and they're really, really difficult. So a lot of students, if you're listening to this, if you're going to take a class outside of your school, physics should be the one if it's notoriously hard at your school. And you should talk to upperclassmen to see if it's actually difficult, because a lot of students will get C's in physics and it will bring down your grade tremendously. So if you're going to take a class outside of your university, and I typically tell students don't take more than one class outside.
Yeah, you don't want to seem like you're running from all the prereqs at your university.
Exactly.
But I think ironically, a lot of pre-meds, also the class they end up taking at a community college when they're back home for summer because they want to knock it out. Or it's hard to do that now, though, because most universities that you attend will let you do online classes, but it ends up being physics. With that said, I like at Cornell, we had calc-based physics, and then we also had non-calc based physics. And so I definitely recommend not taking the calc-based physics if you can. That's less engineers in those classes. And so, yeah, you might have a school that actually offers two different options. So if you do, then just make sure you're choosing the right one that qualifies as the prereq, but is easier. Unless you absolutely love calculus and you want to go take that one, then God bless.
Yeah. Same thing with us.